SNP ministers were accused of denying beleaguered family doctors almost £660 million of support. Image, Alamy. It comes as Chancellor Philip Hammond is expected to use today's budget to find a promised £20 billion annual cash injection for the NHS south of the border. Under the Barnett Formula, Holyrood should receive 9.8% of that. Mr. Hammond's spending spree is designed to confirm the UK government austerity is over at last. Scottish Conservatives have called for every penny of the extra funding to be spent on a health service north of the border. They have also argued 11% should go directly to GPs amid warnings that family doctors are under soaring pressure due to a lack of staff and funding. 1 in 4 clinics have at least one vacancy and a third of GPs plan to retire in the next 5 years. The shortage of medics has hit rural practices particularly hard, with several forced to close their doors. Tories said the latest figures revealed that if NHS Scotland had invested the same proportion of expenditure in GPs as NHS England over the last 4 years, they would have received £658 million extra in real terms. Miles Briggs, the party's health spokesman, said, "GPs provide so many crucial services in the community that it is vital they get the funding they need." These figures show the SNP has been systematically underfunding our GPs. It is no wonder GP practices are closing across the country as GPs are unable to cope with the financial pressures. The SNP is about to receive £2 billion from the UK government. That record investment must support GPs. GP spending in England rose by an average 8.13% per year between 2013-14 and 2016-17. This compares to a 7.14% annual increase in Scotland over the same period. The Scottish government insisted it had delivered record-high health spending and staffing, and warned Mr. Hammond against cutting funding in other devolved areas. A spokesman for Health Secretary Jean Freeman said, "Spending per head in Scotland is more than 7% higher than the rest of the UK, meaning if we were to follow Tory policy, our NHS would face a cut of more than £850 million. Meanwhile, the UK government's shambolic Brexit plans threaten to cut NHS staff numbers. Philip Hammond is expected in today's budget to find a promised £20 billion annual cash for the NHS. Image, Getty. As for the UK budget, any increase announced for the NHS must be delivered as a true net benefit, and not be offset by other cuts to Scotland's budget as part of a Tory smoke and mirrors exercise. In his annual set-piece financial statement to the Commons, Mr. Hammond will pledge an extra £2 billion a year for NHS mental health care. The Chancellor will also unveil extra cash for environmental projects including £60 million for planting millions of trees in a new, Great Thames Park in the Thames estuary. Mr. Hammond's budget includes £30 billion of investment in road building, £1 billion for social care, extra cash for the universal credit benefit system. A decade after the 2008 financial crash, the Chancellor is expected to loosen the Treasury's purse strings in a drive to stimulate the economy ahead of next year's departure from the EU. In a series of television interviews yesterday, he insisted Whitehall spending restraint since the Tories came to power in 2010 had slashed the deficit and paved the way for increased investment in public services and national infrastructure. The public finances are performing well, Mr. Hammond said yesterday on the eve of today's budget, the first on a Monday since 1962. Joel Barnett, Chief Secretary to the Treasury, came up with the Barnett Formula. Image, Gary Weeser, Keystone, Getty. "I have chosen a balanced approach which places equal weight on getting the debt down, keeping taxes low, supporting our public services, and investing in the skills and the infrastructure and the technology that will drive Britain's future prosperity." Clearly, the monthly figures show that borrowing has come in lower than we expected. The economy is performing strongly, public finances are performing strongly, not least because we've taken, over the last 8 years, a huge number of steps to close the tax gap to make sure that we're collecting all the tax that we're entitled to. Meanwhile, SNP Finance Secretary Derek Mackay said Theresa May's Conservative Party conference pledged to end austerity should lead to action. He said, "The Prime Minister said austerity is going to end and I'm saying to the UK government, show me the money." That means a substantial, meaningful uplift in addition to the health commitments, which I welcome, and it must not be offset by cuts elsewhere.